Assalamu alaikum. My name is Amranwar and my roll number is BP1650196. Today the topic of my presentation is Glibenclamide, which is an anti-diabetic drug. First I will talk about the brief information of Glibenclamide. Another name of Glibenclamide is a glyburide, which is a second generation sulfonylurea anti-diabetic agent with a potent and prolonged hypoglycemic effect. It means it has the property to decrease the blood sugar level. If the patient is suffering from hyperglycemia, that is, have a high blood sugar level, Glibenclamide is a medication which can control the blood sugar level in the patient and decreases their blood sugar level. It is used an adjunct to diet to lower the blood glucose in patients with non-insulin dependent diabetes mellitus, that is type 2 diabetes. Rational use, that its important use, or it has some useful effects on the patient, which are: it controls high blood sugar, helps prevent kidney damage, blindness, nerve problems, loss of limbs and sexual function problems. So we have to take 5 mg of glyburide or Glibenclamide with a proper diet and with exercise to control high blood sugar level in the patient and also to have some beneficial effects in the patient. There are also some harmful effects of Glibenclamide. If we have the overdose of Glibenclamide, or we take the Glibenclamide without the proper medication of general practitioner, then we will come to the side effect of Glibenclamide, and these side effects may include weakness, low blood sugar, dizziness, hunger, sweating, trembling, blurred vision, walking unsteadily, or fast heartbeat. That's why its irrational use can be applied in suicidal attempts. Now there are some alternative choices for Glibenclamide. That is, if the Glibenclamide is not available in the market or there is some shortage of Glibenclamide, then we can take other drugs which have same formula as Glibenclamide. We can also take these drugs, which are Eviglin, Jetrol, Glibovin, Glynil, Downil and Denil, which are all in tablet forms, and they have some difference in retail prices also. There are three alternative brands with low and high price. That is Diabeta with price of 30, Diabenil with price of 39 and Disugar with price of 83. So the most preferable dosage form or drug will be Diabeta to control the high blood sugar level in the patient if Glibenclamide is not available. Now there is also a case presentation related to Glibenclamide. A 77-year-old gentleman presented to the general practitioner with complaints of fever, loose motions and rosiness of 1 day duration. His fever was low grade, intermittent, not associated with rigors and chills. He had experienced 4 episodes of watery stools during the previous 24 hours with no associated vomiting. The patient was drowsy, aphasic, did not recognize his family members and was unable to walk. The local general practitioner found him to be hypoglycemic with a blood sugar of 45 mg per dl. He was managed with dextrose and referred to the hospital. There was no history of decreased food intake. The patient had been taking normal diet. Now in this case, we will come to know that there is a gentleman who is very old and he has a complaint of fever, loose motions and rosiness. The patient was drowsy, aphasic and also did not recognize his family members and also not unable to walk. Okay, now the local general practitioner found him to be hypoglycemic. That is, general practitioner found him that he has a very low blood sugar level, that is 45 mg per dl. So first we have to diagnose the patient that which medication causes him a side effect or causes him this condition. So the patient was a diagnosed case of hypertension, renal parenchymal disease grade 1 and type 2 diabetes mellitus, had been taking the tablet form of Glibenclamide 5 mg twice a day for the past 5 years. Amlodipine, Bezylate 5 mg occasionally and dutasteride and tamsulosin combination for his benign prostatic hyperplasia. His last dose of Glibenclamide had been administered 24 hours prior to admission. The patient was brought immediately to the hospital. He was pale and dehydrated, while his examination was otherwise unremarkable. His blood glucose was 50 mg per dl and his other lab tests are also mentioned here. So after diagnosis, we came to know that the patient is suffering from hypoglycemia, dehydration, weakness, fatigue, and it all because of side effect of a Glibenclamide. Now there is an assessment that what we have to do for the patient to stable his condition. He was placed on 3 hourly blood glucose monitoring record and was started on IV 5% dextrose along with normal saline. An intake and output record was maintained. Over the next 24 hours, the patient experienced repeated hypoglycemic episodes that were treated with dextrose boluses. Okay, now the patient has to place on glucose monitoring record for 3 hours, and he also be given 5% dextrose along with normal saline IV. In this condition, the patient also suffering from repeated episodes of hypoglycemia, but when the patient became normal again, he was discharged from the hospital with a certain plan. And the plan will be, the patient was asked to follow up in 1 week with blood glucose readings. All the hypoglycemic agents were withheld, that is, do not give any hypoglycemic agent to the patient so that his blood glucose level will become low again. The patient was asked to maintain a record of blood glucose levels. He was advised to take Glibenclamide on an required basis. His renal profile remained unchanged after 1 week, and his self-monitored blood glucose levels were within normal limits. He was well controlled on diet and exercise, hence no antidiabetic agent was restarted. Now there is a discussion about hypoglycemia. As we all know that hypoglycemia is a condition in which there is a low blood glucose level in the patient, which causes them very weak, drowsiness, fatigue in the patient. So the patient has to take antidiabetic agent which causes low blood sugar level according to medication, or if it is prescribed, or only if it is prescribed by their general practitioner. Do not take any antidiabetic agent without their medication, without their advice of general practitioner. Now there is a drug-drug interaction of glibenclamide. Combination therapy with an insulin-stimulating agent, that is glibenclamide, and an insulin-sensitizing agent, that is metformin, is an optimal and rational therapeutic first and second line treatment in patients with type 2 diabetes mellitus. Okay, it means that there is a combination therapy of glibenclamide with metformin always. With metformin, glibenclamide has a very high therapeutic effect in patients, and it also gives a better results with metformin. The improved convenience of fixed dose glibenclamide metformin may improve patient compliance with treatment, thereby improving the glycemic control. Sulfonylurea toxicity. Hypoglycemia can occur at therapeutic doses, especially in those who develop renal impairment. Okay, now as we have discussed before, that any antidiabetic agent has to be taken with a proper prescription by their general practitioner. The overdose of the glibenclamide may cause side effect in the patient, so we have to take the glibenclamide according to the dose of their according to the prescription of their general practitioner, so that we cannot undergo any toxicity, or we cannot suffer from any toxicity of this medication. If we have undergo the toxicity of this medication, then there is also an antidote for this, which is octreotide. But do not start the antidote until a documented hypoglycemia has occurred. Equally, giving boluses of dextrose without an episode of hypoglycemia complicates the risk assessment. Once hypoglycemia does occur, make sure you have enough supply of octreotide. That's all for today's presentation. Thank you.